There are so many different reports about COVID-19 out there, it can be hard to know what to believe, so we're bringing infectious diseases physician Sanjaya Senanayake back to do some myth-busting for us. Sanjaya, great to see you again. Let's start with face masks. Back to the subject again, we spoke about that weeks ago, but US health officials have changed their stance on them, saying people should wear them to stop the spread. What do you think? Should we do the same here?
So, Michael, the US situation is unique, quite different to ours. They've got almost 200,000 confirmed cases, and because of their woeful testing, 313 tests per million people, the real number is much higher. The epicentres in a high-density area of living, New York City, so they are facing a serious issue, and I think they're very concerned and they're trying any measure to bring those numbers down. Now, in Australia, we've only got about 4,000 cases. There's hardly any community transmission. In the ACT here, for instance, we've got none. Therefore, we would have to wear lots and lots of masks to get even the slightest benefit. And those masks will be taking away from the supply that's needed for healthcare workers. And of course, wearing masks can also lead to a false sense of security, not using enough hand hygiene, for instance, and not social distancing. So we don't need it here.
One of the things I read that I thought was really interesting, though, talking about it was like a little reminder not to touch your face and not to do a lot of those things that people normally do. Are there ways that we can sort of ensure our protection in those sort of forms?
Yeah, there was a study from the University of New South Wales showing that students would touch their faces 26 times in an hour on average. Without even being aware of it. So I think it is just a matter of training ourselves to behave in a different manner. I'm trying to learn how to not shake patients' hands. It's very hard after decades of doing so.
Yeah, it's such a habit, a forced habit, isn't it? Now, look, Sanjaya, there are some concerns over the new rapid finger prick blood tests. We spoke about that. There was so much hope about them. Pathologists are warning they may not be effective when they come online. What's your take on that?
Look, it's definitely something to watch out for. There isn't just one rapid test. They've come out from a number of manufacturers. There are different kits. In Italy, we saw one kit that came from China only picking up 30% of COVID-19 cases, which was a concern. And the problem is because it's an outbreak and these have been brought out fairly quickly, they've undergone some testing, but perhaps not the rigorous testing they normally would. It's important that when we start using them in Australia, we try and ensure that we are getting accurate testing. So perhaps making sure that the nasal swab that we take is also tested when we do the rapid test, just to make sure they're accurate.
Yeah. Sanjay, I had a note from a viewer asking if an air purifier can help with them, particularly for people that have asthma or lung problems. Does it do anything?
So for COVID-19, an air purifier is probably not going to make a big difference. Now, air purifiers are quite complex, advanced machines. Some of them contain these HEPA filters, which can capture small particles like bacteria and viruses. But of course, it's worth remembering that they won't capture all the virus particles in a room, just a proportion. And most importantly, with COVID-19, it's spread by droplets, which are coughed or sneezed and fall rapidly to the ground. They don't hang in the air for very long, unlike some other viruses.
So, Joe, let's just talk for a minute about people in relationships who don't live together. This has been hard to work out and seems to vary state by state, but is it safe for them to visit each other?
Look, my take on that is yes, it should be. I would think of people who are spending a lot of time together, although they don't live together, as being similar to a family in the same household. So they should have contact with each other as they normally would. But again, in a household, if someone now gets a respiratory illness, particularly an adult, we would expect that person to minimise their time with the other members of the household. Similarly, if one person in the relationship is unwell, they should stay away from the other person till they get better.
Okay, and cleaning. We've all never cleaned our hands and surfaces and everything so much. We know that the virus can live on some surfaces for up to 3 days. So what's the best way to clean them to ensure we're safe? Is it just simply disinfectant?
Yes, so this is an enveloped RNA virus, this COVID-19 coronavirus, and soap and alcohol and detergents, standard detergents, will kill it quite quickly. So there's a lot of options there to clean surfaces.
All right, Sanjay, always excellent. Thanks again for being there for us tonight.
Thank you.